Ever looked at your hands, your skin, or even your breath and thought, that's kind of weird today? Most people shrug it off. Maybe you blame stress, a bad night of sleep, or just getting older. But here's the wild part. Your body is constantly dropping little hints about what's happening inside you. And one organ that loves to send signals before things get serious is your liver. Yeah, your liver. Most folks don't think about their liver until something goes really wrong. But in reality, liver disease is way more common than people realize. Doctors see it every single day, and sometimes the signs are so obvious that a trained eye can spot them the moment a patient walks through the door. So let's slow down for a second and talk about something important. Imagine your body is like a city. Your liver, it's basically the cleanup crew, the recycling plant, the chemical factory, and the security system all rolled into one. It filters toxins, processes nutrients, stores energy, and helps keep your blood balanced. In other words, it's doing a ton of behind-the-scenes work every single second. But when the liver starts struggling, the body starts sending signals, and those signals can show up in places you'd never expect. Let's start with something simple: your fingernails. Sounds strange, right? But your nails are actually one of the easiest places to spot changes in your health. They grow constantly, and that growth requires energy, nutrients, and healthy circulation. When something inside your body isn't working properly, your nails can reveal it pretty quickly. Sometimes people notice pale nails that look almost white instead of their normal pink tone. That pink color usually comes from tiny blood vessels underneath the nail. But when the liver isn't producing enough proteins, like albumin, the tissue under the nail changes and those blood vessels become harder to see. The result? Nails that look unusually pale. Another thing you might notice is white horizontal lines that stretch across the nails. These lines don't move as the nail grows, which means they're actually coming from the tissue underneath. That kind of change can be linked to low protein levels in the blood, something that often happens when the liver isn't functioning at its best. Now, here's another little test you can try right now. Put the tips of your fingers together like you're making a little triangle with your nails. Normally, there should be a small diamond-shaped gap between them. If that gap disappears and the nails curve around each other, that could be something called clubbing. Clubbing happens when the tissue around the fingertips thickens. Sometimes it runs in families, but doctors often look for problems with the heart, lungs, or liver when they see it. It's one of those clues that tells us the body has been dealing with something for a long time. Now, let's move from the hands to something a little more dramatic: your belly. Sometimes people show up at the hospital with a stomach that looks extremely swollen. At first glance, someone might think the person is pregnant or just gained weight, but in some cases, the abdomen is actually filled with fluid. This condition is called ascites. And believe it or not, the body can accumulate several liters of fluid in the abdominal cavity. To understand why that happens, you have to know a little about how blood flows through the digestive system. Every time you eat, nutrients get absorbed from your intestines and sent through the bloodstream to the liver. The liver acts like a checkpoint, filtering out toxins and processing everything your body needs. But when the liver becomes scarred, blood has a harder time flowing through it. Pressure starts building up in a major blood vessel called the portal vein. Doctors call this portal hypertension. When that pressure gets too high, fluid begins leaking out of blood vessels and collecting inside the abdomen. Over time, the belly becomes larger and tighter. It can even make breathing uncomfortable because the fluid pushes upward against the diaphragm. When that happens, doctors sometimes perform a procedure to drain the fluid and relieve the pressure. Patients often feel dramatically better afterward, almost instantly. But that pressure in the blood vessels doesn't just cause fluid buildup. It can also force blood to reroute itself through smaller veins that were never meant to carry that much flow. Picture a massive traffic jam on the highway. What happens? GPS starts sending cars down tiny side streets. Your body does something similar. One of the places this shows up is around the belly button. Small veins in the abdominal wall start swelling and twisting under the skin. The pattern can look like branches spreading outward from the navel. Doctors actually have a name for this pattern inspired by mythology. It resembles the snake-like hair of Medusa. Another place this pressure can show up is inside the esophagus. Enlarged veins can form there, and they're extremely fragile. If they rupture, it can cause severe internal bleeding. It's one of the most dangerous complications of advanced liver disease. Now, let's talk about something you might notice on your hands again, specifically the palms. Sometimes the palms turn unusually red, especially around the base of the thumb and little finger. This redness can happen when hormone levels shift in the body. The liver normally helps break down certain hormones, including estrogen. When the liver isn't doing that job properly, estrogen levels can rise, and that can cause blood vessels in the skin to dilate. That same hormonal effect can also create tiny spider-like blood vessels on the skin. They look like small red dots with thin lines branching outward. If you press on them, they briefly disappear before filling with blood again. Having one or two of these can be totally normal, but if someone suddenly develops several of them, doctors start wondering if the liver might be under stress. Another subtle change that can happen with liver disease is muscle loss. The liver plays a big role in storing energy and processing nutrients. When it's damaged, the body sometimes starts breaking down muscle tissue for fuel. The changes can be hard to notice at first, but certain areas give it away, like the temples on the sides of the head or the muscles in the hands. Sometimes the palm develops thick bands of tissue that slowly tighten over time, causing the fingers to curl inward. When that happens, it can become difficult to fully straighten the fingers. Doctors call this Dupuytren's contracture. There's even a simple test for it. Place your hand flat on a table. If your palm can't fully touch the surface because your fingers are pulling upward, that might suggest tightening of the tissue underneath. Now, here's a test doctors use all the time in the hospital. Hold your arms out in front of you and bend your wrists back like you're telling someone to stop. Most people can hold this position without any problem, but some patients develop a strange flapping motion in their hands that they can't control. The hands briefly drop and then snap back up again. It's called asterixis. This movement happens because toxins that should normally be filtered out by the liver begin to build up in the bloodstream. One of those toxins is ammonia, which forms when protein breaks down in the body. When ammonia levels rise too high, it can affect the brain. People might become confused, forgetful, or extremely sleepy. In severe cases, they can even lose consciousness. Doctors call this condition hepatic encephalopathy, and it's one of the clearest signs that the liver is struggling to keep up. There's another surprising clue that sometimes gives this away before any tests are done. Breath. Some patients develop a very distinct smell on their breath. It's slightly sweet but also musty at the same time. That scent happens because certain toxins circulate in the bloodstream and eventually leave the body through the lungs when we exhale. It's a small detail, but experienced doctors often recognize it immediately. Another sign that can appear is yellowing of the skin or eyes. This happens when a substance called bilirubin builds up in the blood. Bilirubin forms when red blood cells break down, and the liver is responsible for processing it and sending it out of the body. When that system fails, bilirubin accumulates. The skin may take on a yellow tint, and even the whites of the eyes can turn yellow. Urine might also become dark, sometimes resembling the color of strong tea. People with liver disease may also bruise more easily than usual. That's because the liver produces important proteins called clotting factors that help stop bleeding. If those proteins decrease, the body struggles to form clots properly. On top of that, platelet levels can fall as well, making bruises appear more often and linger longer. All of these signs together tell a story about how hard the liver works every day and how much the rest of the body depends on it. The good news is that many causes of liver disease are preventable. Excessive alcohol consumption is one of the most well-known factors. Cutting back or avoiding alcohol entirely can dramatically reduce the strain on the liver. Another major cause today is something called metabolic syndrome, which is closely linked to obesity, insulin resistance, and type 2 diabetes. Maintaining a healthy weight, staying active, and eating balanced meals can go a long way toward protecting liver health. There are also viral infections, like hepatitis B and hepatitis C, that can damage the liver over time. Vaccines and modern treatments have made huge progress in preventing and curing these infections. The biggest takeaway here is simple. Your body is always communicating with you. Tiny changes in your skin,